This conference will now be recorded.
Hello, can anyone say you have covered pathology shock topic in pathology, no? You can message if you want. What is the definition of shock? What about your known definition of shock in pathology? Definition of shock will be given differently in different places, but the core concept of the crux, main skeleton of the shock definition is same for everything, for everywhere. It is meant due to poor tissue perfusion with impaired cellular metabolism. Okay, yeah, reduced tissue perfusion. It's like nothing but poor tissue perfusion with impaired cellular metabolism. It's nothing but if you don't eat for so many days, you will try to get some other food. Like if you're not getting rice for so many days, you will try one bread like that. Like that only cells, if it is not getting oxygen for its metabolism, it will turn into normally aerobic metabolism is occurred in cells. If oxygen is not supplied properly, oxygen is nothing but blood supply through which oxygen goes to the tissues, all tissues. If oxygen not supplied properly, it will thrive on anaerobic metabolism. Due to anaerobic metabolism, lactic acid will produce. Lactic acid is one of the dangerous component, and it will lead to some other complications. So, the definition of shock is life-threatening situation due to poor tissue perfusion with impaired cellular metabolism. You have to understand concept nowadays. In pathology, you will get questions probably on shock, but it is not the clinical features. These all are not necessary in pathology. Pathology mainly you have to know pathophysiology. Maybe you have done your pathology professors has done that well. Now we will cover some surgical aspect of you. How shock is divided? What is the classification of shock? How many types is not different, not important. What are the types of shock? Can anyone say? Maybe from your pathology also you can say. Yeah, hypovolemic, cardiogenic, then anaphylactic, hypovolemic, septic, cardiogenic, neurogenic. Yeah, someone said new term, distributive. Yeah, it's nice. It is in, yeah. Okay. Hypovolemic, cardiogenic, obstructive, distributive, and some kinds endocrine will give different separately. So many people in between said septic, neurogenic, and anaphylactic. These all comes under distributive shock. Okay, those are also types only, but uh, they are all included under distributive because of their same mechanism, same type of mechanism of action. Okay, septic, neurogenic, and anaphylactic. And obstructive includes tension pneumothorax and mainly cardiac tamponade. Cardiogenic includes myocardial depression or post-myocardial MI, post-MI maybe. These all are. This, as you all know, we have covered it from last class. And endocrine, maybe hyperthyroid or hypothyroid, and adrenal crisis. Okay. So crux of the topic you may crux of the types of shock you may understand maybe. Huh? Now we can see what are the how these all are differs. Okay. Can anyone remember classification of hemorrhagic shock? I have done in last class. Can anyone message? Yeah, four classes. Someone said four classes. Class one, class two, class three, class four also. Hmm. No one is answering. Yeah, class one, 15%. Class two, 15 to 30%. Yeah, only one student is answering. Why no other people are trying? Only one. No, also only one student is answering. What's the use of telling class if it is like that? See, this is the classes. And we can know some little bit definitions of these shocks also. Hypovolemic, as the name suggests, it is decreased volume. due to decreased circulatory blood volume in relation to the total vascular capacity and characterized by reduction of diastolic filling pressures. Okay, and cardiogenic shock is due to cardiac pump failure related to the loss of myocardial contractility. These are the simple words you can understand. Due to decreased volume, there will be a decreased circulatory blood volume. So hypovolemic shock is that, and cardiogenic is due to decreased cardiac pump failure or cardiac output will decrease. And obstructive is nothing but extra cardiac obstructive shock. It is due to obstruction to the flow in cardiovascular circuit. Due to cardiac tamponade, it is nothing but a collection of fluid around the heart. Because of this collection of fluid, compression of heart will be there and shock will be occurred. And distributor is nothing but caused by loss of vasomotor control resulting in arterial and vascular dilation and characterized by increased cardiac output and decreased SVR. In all other shocks, cardiac output will decrease. The only shock where cardiac output will increase is distributive shock. Okay, distributive shock, one of the important topic in your PG entrance also. As I said, this one, the cardiac output status it increases in distributive shock, and this one we have covered. And what are the minimum requirement to be done in shock? Heart rate, blood pressure, anxiety. CNS is anxiety, urinary output, pulse pressure, and respiratory. SIRS. It is also one of the important. Next, one topic we have covered it last week only. So we are skipping that hypovolemic shock and cardiogenic shock next. It is one of the important cause in hospital acquired mortality due to MI. Because of failure of resuscitation, this cardiogenic shock may occur. As I already told, this cardiogenic shock is due to myocardial infarction, and nowadays because of development of high cardiology centers and all, this cardiogenic shock is decreasing because of proper treatment. Okay, these infarction and other topics we will get in pathology. Because of this isolate infarcts is nothing but enable to tissue perfuse. Blood supply will decrease to that part, so infarction will be there. Myocardial infarction. Okay, uh, as you know, blood supply of heart, there are three blood vessels, three main blood vessels. So many blood vessels. Right coronary artery, left coronary artery, and left anterior descending artery. Because of blockage of clots, blockage of these vessels due to clots, blood supply to the concerned area will be decreased. So heart pump will be decreased. So shock. This is a shock will occur. So shock due to cardiogenic cause. It is uh, called as cardiogenic shock. So treatment is mainly due to inotrope support and uh, early diagnosis and treatment. Okay. It's obstruct. You have to know these concepts just now. These questionnaire and question type things are you can read in ninth sem only, because then exam will be there. Nowadays, now for exam point of view, your pathology shock is enough. Okay. As I already told, obstructive shock is due to tension pneumothorax and cardiac tamponade. Blood or any some fluid collected around the heart. So pumping of heart will decrease. Okay. Treatment of this is cardiac pericardiocentesis, removal of the fluid around the heart. Distribution. As I already told, this include three separate, and three will the common point of is peripheral vasodilation and increase increase peripheral vasodilation and decrease peripheral resistance. But three different examples now. So septic is nothing but due to bacteremia in the blood. Bacteremia is nothing but presence of bacteria in the blood. It will release some endotoxins. Those endotoxins will cause some local dilatory effect on the vessels. So vessels dilated and peripheral resistance will decrease, cardiac output will increase, and peripheral arteriovenous fistulas will be there. So blood supply to the tissue perfusion will decrease. Anaphylactic shock, it is due to allergic. It is type of allergic shock. Due to this allergy, peripheral vasodilation will be there, and same thing. In neurogenic, normally if normal nerve supply is there, vasoconstriction will occur in peripherally. If neurogenic block is there, vasodilation will occur. Sometimes endocrine is nothing but a mixed shock. It is both obstructive and distributive is there, but it is diagnosed as in separate entity because of this endocrine abnormality, like hyperthyroid or hypothyroid or adrenal hypoadrenal also leads to shock. So some next pathophysiology type of thing, as you already know, this pathophysiology of shock. It all started with inadequate perfusion, leads to, it is a kind of arrow. Okay, otherwise I will, it leads to cell hypoxia. Anyone Students, are you understanding these topics or shall I skip now? It is going above your heads or what? Can anyone message? Shall I continue this? Okay. So this is a main concept, pathophysiology. If you understand this, you will get definitely uh, crux of the shock will be understood with this one slide. Here, one or two slides. Inadequate perfusion. Just see like that arrow is there in between these two. Inadequate perfusion, which leads to cell hypoxia, and which leads to energy deficit. Same like if you don't eat, what will happen? So anaerobic metabolism will be started. Which leads to accumulation of lactic acid. Acid, as you suggest, lactic acid. Acid is accumulating, so pH will decrease. What is the normal pH of human being? Can anyone say normal pH value? 7.35 to 7.45. Yeah, someone said. Nice. Yeah, yeah. If this lactic acid will increase, acidic means decreasing or increasing. Yeah, acidic is decreasing and the basic is increasing. So this now you understand this fourth line. Due to anaerobic metabolism, accumulation of lactic acid is there, and because of this, pH is decreasing. So what condition is called? Can anyone say what is the condition if pH is decreasing due to this lactic acid? Do you know these topics? Metabolic acidosis. In physiology, everyone acidosis. Yeah, acidosis is correct, but metabolic acidosis is the correct one. Yeah, good. Actually, at least one or two people. Yeah, it is lactic acidosis, but one confirmed term is there. Acidosis, two types: metabolic and respiratory. Okay. Someone said it is lactic acidosis. Yeah, it is type of lactic acidosis only, but metabolic acidosis we'll call it. These are this acid. One chapter is called acid base balance. This is the most important topic in every subject, maybe in medicine. If patient comes with shock or patient comes with unconsciousness, one thing you should do is ABC, acid base analysis. Okay, in that you will know patient whether is in acidosis, metabolic acidosis, or respiratory acidosis, or metabolic alkalosis, or respiratory alkalosis. With that only we will come to know what is the probable cause. If it is metabolic acidosis, patient may be in shock. If it is respiratory acidosis or alkalosis, patient is having difficulty in respiration or hypoventilation or hyperventilation. Like that, you will come in medicine again these topics. This metabolic acidosis leads to cell membrane dysfunction. Cell membrane dysfunction and sodium pump failure, which leads to intracellular lysosomes and intracellular Lysosomes. These are digestive enzymes. These intracellular lysosomes nothing but these cells will lyse. Lysis means death. Death of the cells will occur because of these components. Some components will be released like cytokines, interleukins, cell membrane dysfunction, which leads to intracellular lysosomes release. These lysosomes were released, and these lysosomes nothing but suicide bombers. They will kill this cell. After cell death, breakage of the cell wall will be there, and toxic substances will release. These substances you will know in this pathology only. Cytokines, interleukins, neutrophils, and something like enter circulation. This leads to capillary endothelium damage. Capillary endothelium is end artery circulations. This if this endothelium damage is there, further destruction, further destruction and cell death. Okay, this is the main crux of this one. And in this one, due to metabolic acidosis, peripheral vasoconstriction will also occur. Precapillary and peripheral pooling of blood will be there. Okay, this is the main pathophysiology. Maybe you have learned in pathology also. Sorry. And some two important topics you have to know with this is changes at the level of microvascular level. It is nothing but activation of immune and coagulation systems. This is nothing but shortening of that pathophysiology. What are the at what level? What which mechanism is happening? Okay, in microvascular level, activation of immune and coagulation systems, hypoxia and acidosis will occur, and activate complement and prime neutrophils. These neutrophils are activated, and these neutrophils activated neutrophils will thrive on our own body cells. So again, tissue destruction will be there, and oxygen free radicals and cytokines are released, and damage of endothelium occurs, which leads to leakage of fluid and leads to edema. These some difficult topic only. You have to know the meaning of these things. What are the mechanisms occurred at microvascular level? As I already told, it because of this release in lysosomes and all, cells are died, and these dead cells will release activation of immune. It's nothing but now China is attacking in India at Ladakh area. So what India is doing, it is releasing more of its para commandos and commandos in the Ladakh area. Same like if any shock or septic shock is occurred or any shock is occurring, body will release its immune components at that level. Nothing but an activation of immune system. As you all know, there are two types of immune systems: acquired, innate, and acquired. Now we will know acquired immunity. It is kind of acquired immunity. Activation of immune system and coagulation systems. Coagulation systems due to uh, body is feeling some blood is leaking over there and edema is occurring. Because of that, coagulation systems are activated. Because of this activated coagulation system, clots are formed, and again damage is increasing. Okay. Activation of immune system, coagulation system, hypoxia and acidosis. Hypoxia due to it is a main component because of decreased circulation and perfusion, hypoxia is occurring. And acidosis, we already know that in pathophysiology, like due to release of lactic acidosis is there. And release of oxygen free radicals and cytokine release, and these leads to endothelium death. As you already seen, death of capillary endothelium destruction. So release of fluid to the surrounding tissues leads to edema. Now we will come to know another level, cellular level. Cellular level, I have already told that from cells switch from aerobic metabolism to anaerobic metabolism and decreased ATP production, lactic acidosis will be there. These are already topics which I have covered. That's why I'm going fast. Basically, this pathophysiology topic is the main thing. From that only these all will come. And decrease in ATP production and lactic acidosis will be. Maybe you have covered in biochemistry, I guess, this one. Anaerobic glycolysis and aerobic metabolism, anaerobic metabolism. How many ATPs will produce from aerobic metabolism? Can anyone say? Around 12 ATPs, I guess. Is it correct? And in anaerobic metabolism, only 2 ATPs will be produced. So, decreased ATP production. ATP is nothing but some energy kind of thing which used by body. So this production is decreasing. So more and more for one aerobic metabolism, more than 15 to 20 ATPs are produced. In anaerobic metabolism, only 2 ATPs are produced. So they have to increase their production. So more and more anaerobic metabolism will occur, and more damage is there, and everything is increasing on its own. And impaired lysosomes will occur, and mitochondria damage, which leads to cell death. Do you understand this one? Shall I stop with this or continue? Only one yes. I'm waiting for your response. Yes means what you're understanding, or you want to continue? Okay. Then next comes metabolic changes. Metabolic changes different. After metabolic changes, I will stop because it is some high. After metabolic changes, I will stop. Okay. And next class we will deal with treatment kind of things. Okay. Metabolic changes. It is different from the changes in shock. It is metabolic changes at different components level. It is different. So like in carbohydrate metabolism. In carbohydrate, it is one of the important component of your body energy system. Okay. So in carbohydrate level, it is a shock is divided into again two types in this carbohydrate level, like compensated shock and decompensated shock. Compensated shock is like body have some glycogen components in in liver. Because of this decreased production of energy, uh, hepatic glycogenolysis is occurring. So hepatic glycogenolysis, which leads to hyperglycemia, which compensates the shock, these shock components. Because of this decreased hyperglycemia, again production of energy will increase. So compensated shock in carbohydrate metabolism, there are two types again. Compensated shock, because of this hepatic glycogenolysis, hyperglycemia will occur. And in decompensated shock, due to hepatic glycogen depletion, hepatic glycogen depleted, so complete usage of hepatic glycogen occur. So glycogen is completed, and again glucose decreased, again patient is having shock component. So if hepatic glycogen component is there, it is compensated. If hepatic glycogen component are depleted, it is decompensated. Next, at the level of protein level, protein metabolism, because of decreased this energy, uh, this intracellular protein catabolism is increased. Catabolism is nothing but breakdown of this protein leads to some release of energy. Some values are there, like in carbohydrate will release around 4.1, I guess 4.1 or 5 something, I don't know clearly, kilocal per kilocal per uh, gram. Protein also same. It is also really same. 4.1 kilocal per gram. Fat. It is different, like 9.1 kilocal per gram. You have to confirm these values. I don't. This is 9.1 correct only. This is 4.5 or something. 3.6 or 4.3.6. Okay. Uh, Carbohydrate level I have completed. This compensated and decompensated, and protein. These are due to metabolic changes due to compensate the shock. Shock is because of the shock and aerobic anaerobic glycolysis and ATP are decreasing. So to increase ATP, body's components like carbohydrate, protein, and fat will depleted. So carbohydrate, which hepatic glycogen is depleting, so it will release energy. And in protein, it increases the protein catabolism and conversion of amino acids to urea, and it leads to release of some energy which will be utilized by body. Then fat also increased endogenous fat metabolism, rise of fatty acids in blood. So these fatty acids will release again energy. So these are the some metabolic changes, and some water and electrolyte changes will also occur. Disturbances. So dehydration and everything will be there. So dehydration and these also occur in this water and alkaline in this shock due to failure of sodium pump, and potassium leads the failure of sodium pump, which leads to causes of cellular swelling due to edema. Okay, with this I will stop here because these are hi-fi topics you may not understand properly. So once you go to once your classes are completed, you can read once. Okay, so I am stopping class here. Thank you for the questions. Thank you.